The U.S. Senate is currently considering a massive budget bill passed by the House of Representatives, which would inflict the largest cut ever to Medicaid and includes a $500 billion cut in Medicare. These cuts would severely impact health care for poor and vulnerable families and seniors. The budget also slashes funding for SNAP food programs and the school lunch programs, which will harm millions of children. And why are they making these cuts? To provide tax breaks for the ultra-wealthy. These cuts will hurt our families and neighbors. We want you to hear stories about real people our sisters in our ministries have met and know personally, who will be harmed by these cuts. They are just a few of the millions who struggle and will not be able to meet their daily needs if these cuts are approved. We would prefer that you hear from these people directly, but because of fear of retribution, the names have been changed and their locations not identified.
Mary is a 58-year-old grandmother who is raising 6 grandchildren of her own. They are receiving good care and love by a family member. She is determined to keep them together and out of the child welfare system. The children are doing very well in school. Mary receives food stamps and Medicaid only to take care of the children. She cannot work due to poor health and the time required for child care. If she loses Medicaid and SNAP, the children will be separated and go into the foster system.
Susan is a 76-year-old female. She had a below-knee amputation, and without Medicaid, she would not have been able to get a prosthesis and continue to live independently. Susan is also on food stamps, which she needs to supplement her Social Security.
Dorothy is 70 years old and lives on a fixed income. She has cancer and was in the hospital for treatment. She uses Medicare and Medicaid for her health care needs. Her income is not sufficient for her to get an apartment. When she can, she stays in a motel, but she usually lives in her car. The proposed requirements to receive Medicaid may mean that she loses her health care.
There are millions of stories like these around the country. The elderly, the handicapped, the families with children whose income is insufficient for their daily needs, and who do not have access to private health insurance. The United States is the wealthiest country in the world. How we tax and how we spend reveals a set of moral choices. This budget is a failure of the challenge of the gospel in Matthew 25, where Jesus says, "As you have done to the least of these, you have done to me." We ask you to join with us in opposing this immoral budget. Please use the link below to contact your senators.